2 brain surgeries, and over the summer is a big help.
You had 2 brain surgeries this summer?
June and July.
So back to back, essentially. You gonna tell me what happened?
So I finally had my baby at the 9 pregnancy losses. And 6 months after that, I woke up, I was blind. Like, I couldn't see anything. 10 out of 10 headache. I was weak. I was falling down the stairs. I thought I was having a stroke. I worked at Grady Neuro ICU, which is a big stroke center. So I go to ER naturally. I'm like, we need to do a CT scan. Like, please run a code Cincinnati, which is a stroke code.
Yeah.
That doctor, racism was at play. It was.
What happened?
He was like, we're not running a stroke code on you. You're not getting a CT scan today. You can go home. I was like, strokes are time sensitive. Like, I really need a CT scan right now, please. Like, I'm begging you at this point. I can't see. He said, you can go take some Pepto-Bismol. It's probably a GI bug.
Welcome back. Oh my God, I'm so excited. Welcome back to another episode of Healthcare Stories with Healthcare Henry. Of course, I'm your host, Healthcare Henry, and today we have a special guest. I'm not going to butcher her name, but it's Rachell Dumas.
No, you did good.
I did. Thank you. Thank you. So glad to have you.
I'm so glad to be here. You just came from New Orleans, so that's why you know how to say it correctly.
Yeah, no, it's because you told me 10 times before. I just be honest with them. It's cool. Like it's cool. Yeah, but no, I did just come from New Orleans. I ate some decent food, but I did not eat at a gas station. We were just talking about it briefly, and then she was like, "Oh, you got to eat at a gas station." I'm like, "Oh, hell no, I'm not eating at no gas stations." But that would be interesting. I got to go back and check it out next time.
Henry will understand once he has a variety of food from a variety of places.
I appreciate it. So you're actually one of the first guests that we saw out, right? Just literally saw your story. I was extremely like, oh my God, this is insane. Like, what happened? And then we wanted to kind of get from you so that they know, because I think a lot of times people think they're going through things by themselves. Mm-hmm. That's a real thing. And it's like, no. There's nothing new under the sun. There's always a story out there similar to it. And in getting people like you who are comfortable enough to be vulnerable to even share their stories is impactful and amazing. So we just wanted to have you on. I really wanted to kind of get to know you a little bit better. And you've already told me a little bit. You're from New Orleans. Mm-hmm. Born and raised?
Born and raised. I've been in Atlanta, though, for 20 years. Hurricane Katrina was 20 years ago this year.
That's what brought you to Atlanta?
Yep, I evacuated here.
Did you lose anything
I lost everything for the second time. Like 3 years prior to Katrina, a tornado just destroyed our house. And it was finally fixed 5 months before Katrina.
Oh, my God.
Yeah.
Why not leave after the first time?
Well, I'm in high school and middle school.
Oh, yeah. So your family.
Yeah. So I was a child. But family, everything is built there. And New Orleans people don't like to leave New Orleans. Like,
I've noticed.
Yeah, we like stay in New Orleans. I wanted to leave, but for different reasons. But the culture, the family, all of it just keeps you there. It's just nothing like New Orleans. And it's just you feel the culture when you get over that state line.
Yeah, I just went a couple weeks ago. I was telling you for a day, but I didn't really get a chance to dive in and really get some of the food and really get the culture. But I was there. It's very interesting. I've been to Mardi Gras, of course.
Have you?
But that was like in college. And I was in college like 15 years ago, supposedly.
Okay.
I just found out yesterday. I've been out of college for a while now. So yeah. But no, it was a while ago. So I'm a little bit older. But coming from Katrina to Atlanta, what's the difference? What's it like growing up in New Orleans?
It's so different. The food is different. The culture is different. New Orleans is way more niche than Atlanta.
Okay.
Atlanta is a transplant city. New Orleans people are from New Orleans. Yeah, people in New Orleans are from New Orleans and Atlanta. We have a variety here. Even the restaurants are different. Transparently, I was just flabbergasted that we didn't get Mardi Gras off. So I was like, it's a culture shock. But I liked Atlanta. It felt like my second home when I evacuated here. And I wanted to stay here because something about New Orleans, it's so many successful people, but the culture is different and it tends to make you complacent for some people. And I didn't want to fall into that. So Atlanta looked like this big, bright city where I could do anything. And it really was. And has been for me.
So is it the complacency or where the cost of living is just lower and you don't have to do a lot, right? Versus coming to a big city where it's like you want an apartment, it might be $2,000, where in New Orleans you might be able to get the same apartment for $700.
Yeah. Well, we're also talking about in 2005. I was doing Katrina. I was a week and 3 days into high school, so my lens was very different. I didn't care about cost of living.
Right.
I also had a rough childhood, and I was trying to get out of that. So I felt that Katrina was my opportunity to do so. And once I got into another state and evacuated there, I'm like, oh, I gotta stay here.
What does rough childhood mean to you?
A lot of neglect, even false imprisonment by family members, my mother specifically, and I'm not sure why. Like our equivalent to defects wasn't called and things like that. I sought refuge in school. I was very driven, all A's valedictorian. But at home, I wasn't fed, taken care of, and we were locked in the house outside of school. Like family members would come and save us. So it was very much a need to get out of New Orleans for me that was deeply rooted. It wasn't like everybody else, like, better opportunity. It was like survival. I need to get out of the city and the state.
How many siblings did you have, or do you have?
One.
So the two of you were just growing up with your mom and dad, or?
They were in an abusive relationship. And then my father, I hadn't seen him since 7. I saw him one time at the Katrina in Marietta, apparently. He hadn't moved. I just saw him walking on the street on Auburn Avenue.
Did you talk to him?
He's best friends with my best friend's father, which is kind of crazy. So every now and then I hear he asks about me and even brags on like, my accomplishments. Yeah. But he never directly reached out. As far as my mom, she is trying to make a comeback. And since I had my baby a few years ago, she's been trying to be a grandmother and things like that and restore that relationship. So
now here you are trying to navigate school, straight A student. How do you do that and still be hungry?
That's an interesting question. I ate at school. My grandmother lived across the street and my aunts lived on the side of my grandparents. Like our family had a whole block. So when my mother was deaf, which added another layer.
Completely deaf?
Completely deaf. And so I could sneak out the house sometimes if she was in the back of the house. In New Orleans, we have shotgun houses, which means you could shoot a shotgun and it goes straight through the house without.
Okay.
Did you know that history?
No, I did
look
not.
at me teaching you something.
Yeah, teach me something.
You shoot a gun at the beginning, like the front of the house. It should go straight through the house without touching anything.
Because that's the way the house is set up. It's just a straight front door to back door.
That's why it's called shotgun house.
Got you. So it's a small house, I'm assuming.
It's long.
But it's just like short. A ranch style house, but the other way.
Yeah.
Got you. Okay. Yeah. Okay.
There's a tour in New Orleans that goes to our architecture and all this stuff. We took, of course, I've been on it in school, but what happened is I ate at school. That's why school was such a big thing for me. It still is now. Like it's embedded in me. I'm probably going to go to law school after I finish this doctorate degree.
That's a lot of school.
I love school.
Really?
Yeah. But it was a safe haven as a child. Now it's just something I just love to do. But when I wasn't in school, like weekends and summers, they were rough. Evacuations would save me because we had to leave the house because of hurricanes that summer, June to November. But otherwise, my grandmother lived across the street. Sometimes they would sneak us food through the window or knock on the door and argue with her to get us food. Or sometimes.
So they knew. Your grandparents knew that you were malnourished.
My family knew.
Why didn't they just come grab you out the damn house?
That's a great question, Harry.
Oh, sorry. I'm like...
They knew. Like, everybody knew it was a thing in a family. But we know, like, sometimes in families, the family rapist is protected. The person who does crazy things in the family, they're protected. And I think that's what it was. I never had a chance to ask that question, like, how did y'all watch this?
Right.
Or even helped us and just not remove us from this situation.
Right.
But, yeah, that's what I would do. I would just go by their house.
So you come from there, because that's a whole thing. And then you're now coming back to, or coming to Atlanta. Mm-hmm. Now you're what, 14?
Yeah. 2005. Yeah, 13, 14.
Did you go to school as soon as you got here? How did you even find placement here? Yeah,
so Katrina hit, I was a week and 3 days into high school. We had to obviously take a break. We evacuated, lost everything. And for me, that was the second time. I went back to school maybe a month later. I had to be back in school. My family was trying to decide if we were moving back to New Orleans or staying in Atlanta. Everything was destroyed. Where were we going to go? So there were trailers. I don't know if you remember in '05, like there were white trailers in front of people's properties, and that's where they lived at. If you had a certain amount of people in your family, you had more trailers. But we ended up staying in Atlanta with family and going from house to house to different distant family members. Maybe a few months to a year later, they all moved back, and we were in this destitute house, and it was really bad. I was sleeping on the floor. There were rats and roaches, and even then I was like, I'm back in New Orleans. I got to get out of here. I got to get out of here. Now it's really bad. Like, God, like, please get me out of here. And my cousin was like, we were moving back to Atlanta. I begged her, let me come. I made a PowerPoint presentation on the pros and cons of moving back to Atlanta.
At 14?
At 14, and presented it to my family, specifically my grandparents, to ask them to financially sponsor me.
Huh.
And they said, absolutely, we believe in you. I went back. They made sure all my expenses were covered. And that's when life really started in Atlanta, where I was stable for the first time.
Where are your grandparents?
My grandmother, who was really my mother, she died during my pregnancy journey in 21.
Sorry.
I actually lost a baby on the day of her funeral. And my grandfather is in Slidell, New Orleans. He's in a nursing home right now. So,
have you been to visit him recently?
Not recent, in the last few months. We'll get into it, but I had my own health issues over the summer. So,
but you're also a nurse.
Yeah.
So health issues to you are not health, like they look different for you and other people.
Yeah, but 2 brain surgeries and over the summer is a big health issue.
You had 2 brain surgeries this summer?
June and July.
So back to back, essentially. You gonna tell me what happened? If you don't want to, that's fine.
No. So I finally had my baby at the 9 pregnancy losses. And 6 months after that, I woke up, I was blind. Like, I couldn't see anything. 10 out of 10 headache. I was weak. I was falling down the stairs. I thought I was having a stroke. I worked at Grady Neuro ICU, which is a big stroke center. So I go to ER naturally. I'm like, we need to do a CT scan. Like, please run a code Cincinnati, which is a stroke code.
Yeah.
That doctor, racism was at play. It was.
What happened?
He was like, we're not running a stroke code on you. You're not getting a CT scan today. You can go home. I was like, strokes are time sensitive. Like, I really need a CT scan right now, please. Like, I'm begging you at this point. I can't see. He said, you can go take some Pepto-Bismol. It's probably a GI bug.
And I guess this is where this gets so crazy for me, right? And the biggest reason is because I don't think people really understand. This is him talking to a nurse who knows what the hell she's talking about. What are everyday people experiencing?
Exactly.
That is probably the scariest part of healthcare for me.
Right. Because another patient could say, oh, he's a doctor. 100%. Most patients, right? 100% trust him.
100% agree.
Girl, there's a new bug out here making people blind, right?
Except you'll be probably expired within a couple of hours, right?
Right. So then what goes on is in the background, yeah, she had a stomach bug, she went blind, then she died. Y'all have to watch out for the stomach bug.
Do you feel like that was a racism thing, or do you just feel like the doctor was just negligent?
Both.
Both?
Both. He kept looking at me like... So then I started to flex my knowledge, right? Sir, I'm a neuro ICU nurse. These are stroke symptoms. We got 90 minutes for this treatment. We got this.
Oh, you know. This is literally what you do.
Yeah, I'm NIH certified. I know neuro. Like maternal health, I didn't know that going in. I came from Grady. Grady raised me neuro ICU. Like trauma and neuro is my thing.
Yeah.
You can't do that to me, sir. So then I really started talking the jargon with him. And he was like, oh, I guess you know something. Just a little bit, sir. Can we go to the CT scan, please? Then he said, well, the CT scans are down.
At Grady?
At the other hospital I was at.
Okay.
No, not at Grady. Grady would never.
I'm about to say,
Grady
okay.
would never.
Okay.
Never. So I had, like the person I was with call imaging.
Mm-hmm.
I said, please call imaging, look up, because I can't see.
Right.
The lady was like, yeah, CT scans are fine, MRIs are fine. I'm not sure what that doctor is talking about.
He just didn't want to order the scan for you. And this was this summer.
This was about 2.5 years ago.
This is when you first started getting the, I guess, the diagnosis, if you will. That's when you first came about.
Yep.
Did you see, and I want to come back to this, did you see the video of the African-American woman having the baby? What are your thoughts on that?
I mean, which one, the Indiana or the Texas?
Both.
Horrible.
Yeah.
Horrible. So I've been seeing a lot of reaction videos, and, we all agree that's horrible. That's birth trauma. It's insane. Nobody not only listens to Black women, but they don't believe us.
Is it Black women or all women?
It could be all.
It's all.
People.
I mean, for the reason why I asked, so I look at what we get, right? And so from multiple hospitals, we get a ton of transfers. Always women.
Right.
Always women, different races. I think people are like, well, it's Black women. It's like, and I'm not saying it's not, but we get a ton of women who all say they do not believe we're in pain.
They don't. They superheroes. We look great. There were times where, like over the summer before my first brain surgery, I had my Ray-Bans on. They're prescription. Like, they're just prescription. My eyes was too sensitive. The pressure in my head was so big, I had to wear glasses. I had a doctor say, oh, you probably don't even need a CT scan. You probably could go home today. I'm like, sir, I could barely see you. What are you talking about? He's like, you look good. Did a CT scan. The amount of fluid and pressure in my brain was so bad that it was collapsing my vessels, and I barely was getting brain flow.
So how much time did you have had they not gotten you into surgery or anything?
So from that time, it should have been shorter, but it took like a week to get into my first surgery. And it was arguments with the healthcare team, advocacy. Henry, nobody prepares you when you are sick. Like when you're really sick, and to the point where you need brain surgery, you can't see, that you also have to go into this hospital ready to argue with the very people who have to order the things that you need. That is exhausting.
Who are you arguing with? Is it the insurance company or the hospital?
Sometimes it's insurance. That wasn't even my issue. Everything was covered.
Yeah.
Like insurance company was like, man, she dying, whatever,
Yeah.
It was the healthcare team. Y'all already told me I needed these surgeries. But you're saying, oh, a stroke might come in or this might come in. But I'm over here right before surgery. I vomited for 16 hours straight. My kidneys were failing. I couldn't walk. The compression was so bad in my spine and my head that I literally couldn't walk. It was too numb. I was blind. I went in there just hoping I could make it out, essentially.
And again, I guess for me, it's just like how many people, for one, don't get the story out. But most importantly, how many people are not nurses, right? They have no background on what's going on.
Right.
And this is after you had a child?
So 6 months after I had my baby, that's when I woke up blind, went to that ED. I then, of course, after he just refused to treat me, right, went to another ED immediately, stroke code, CT scan, MRI. They did the whole thing. Reasonably so, because that's what we do.
Right.
They didn't find anything with that type of CT they did. So I had to get a lumbar puncture. It showed that the pressure in my brain was so high, I could have stroked out at any time.
Definitely, sure.
Right? So they put me on a medicine, like a water pill diuretic to decrease the fluid in my brain. I was diagnosed with idiopathic intracranial hypertension. For no reason at all, fluid just accumulates in my brain.
Now?
That's what the diagnosis, yeah. Now I'm fine, but then 2 years later, this year, finishing my master's degree, finished April 30th, May 1st, wake up blind. Thank you.
Again.
And this time it's worse. Symptoms are worse. Headache is worse. I didn't think it could be worse.
Did it feel like your head was exploding?
Yes.
Okay.
Like it felt like an overfilled balloon. Like any time it was just going to pop and I was about to die. Like it was bad. Go to the ER, get a lumbar puncture. This time the pressure in my brain was significantly higher than originally diagnosed. Horrible. Like, it took some of the fluid out. Immediately, I felt fine. So the issue was the medicine stopped working, and I needed surgery at this point. It had compressed my vessels in my head so much to the point where I was about to have a stroke. I'm surprised I haven't. And maybe I could have. I just didn't catch it. But had the first brain surgery. Immediately symptoms relieved. A month later, I woke up blind.
Mm-hmm.
Here we are again. So they did another CT venogram, a certain type of CT I have to check my vessels. It's compressed again. It's bad. Really barely any blood flow on the right side of my brain. Back to surgery table. I'm finishing my MSN program right at the time, so I'm in research mode. I'm like, there has to be something going on. I can't keep having brain surgery. Because now we're looking at a VP shunt, which is consistent hospital stays. The quality of life will go down for me. Like, I'm a very active person. So we found this article showing that GLP-1, like Ozempic, was being used as a secondary use for intracranial hypertension like I have to decrease the pressure in my head. If you start it within 12 to 24 hours, it decreases the pressure. And this was studying 44,000 people with the same rare disease I have over 20 years. Study just ended last year. I started a GLP-1. I've weaned off my medicine, no surgeries, clean bill of health.
Look at God.
Look at God.
That it's so interesting because, again, had you not been a nurse, had you not known, because you did your own research.
Yeah.
So the hospital didn't even say, let's try other options.
I'm bringing it to my team. I'm like, we need to try this GLP-1. Start me at the lowest dose. What implications, like what can you come up with that would be like, a red flag for me? None? Yeah. Okay. Or if it's a red flag, is it a really big red flag or a yellow flag? We need to start this medicine. We need to take the risk because we don't know too much about GLP-1s. We just started using them.
Right.
But
wide scale.
Yeah.
Some people have been using it for a while.
Yeah, they have. Yeah, but there's not enough research for in certain situations. So, but the research I found was enough for me. 20 years is great.
7 is enough, really.
yeah. So
that's interesting. And then that comes after having your first child. And I know, and I'm just going to say I saw it. So 9 lost kids.
9 lost.
What was that like? How long was this? What happened?
So that was a 4-year journey. 2018, I finally gave birth 12/30/2022. And I mean, that was just traumatic and insane. 2018, positive pregnancy test at home, go to the OB because I was bleeding. And he's like, yeah, you're having a miscarriage, but it's fine. Like, you're going to have a baby. Don't worry about it. First of all, in healthcare, we never tell somebody that something definitely is going to happen.
I never heard it before.
Yeah, it's just you can't make that promise. We don't know. Like, I would never say that to anybody. But that was far from the truth, right? So 2020, I'm pregnant again, bleeding. This time I go to the ER. I have twins. They're like, hey, you have a subchorionic hemorrhage, which is when a baby implants, sometimes it forms a pocket of blood around where they implanted it. Most of the time, it's reabsorbed. It's cool. But there's a small percentage of times that it's not. So he said follow up with the OB. By the time I get to the OB 3 or 4 days later, I'm bleeding worse, 10 out of 10 cramping. I am sick. I'm vomiting. I'm sick. I'm sent home. Ultrasound is good. Sent home. Ultrasound is good. 13 weeks and 3 days, I lose the first baby. All my symptoms are resolved. And I'm like, okay, cool. Like, I'm fine. 1 baby. I could do this. It's cool. One day I woke up wet at 15 weeks and 3 days. And I'm like, oh, okay. What's going on? I went to the bathroom. The baby fell out in the toilet.
How far along were you? 15
weeks and 3 days. I go to the ER. The same ER I've been to like 8 times. Like 8 times. I get in there. The doc is like, hey, what's going on? I'm like, yeah, I'm a patient here. I've been in this ER quite a few times, but I'm 15 weeks and 3 days, and my baby just fell in the toilet. She said, how do you even know you were pregnant?
outside of the fact that you just saw a baby in a toilet?
I was like, excuse me? Like, do you want to see a picture of the baby in the toilet? She said, yeah. Like, I really don't believe you were pregnant. So I show her the picture. And she said, oh, that's a baby. Yes, ma'am. That's a baby.
But to me, this is still like traumatic, right? Like, this is not. How many of these did you have?
9.
So just back to back to back to back
Back to back. There were, after that, I was diagnosed with cervical insufficiency. So my cervix is too weak to carry a baby full term. I need a suture or stitch around my cervix to keep a baby in. I'm like, okay, cool. Now I have a diagnosis, so I could keep going. Now I just have to make it to 13 weeks. I had a few early miscarriages. I'm telling my OB, never refer to a specialist. And it wasn't until a manager of mine was like, you need to go to a reproductive endocrinologist, see what's going on with these early miscarriages too.
Right.
I go there and a reproductive geneticist. And they're like, yeah, everything is fine as far as autoimmune disease, thyroid disease, vitamin D deficiency, which are common causes of miscarriage. That test that could have been done with the first loss.
For sure.
That doesn't happen. She's like, okay, we're going to schedule you for a procedure to look at your uterus and all of these things. And I get pregnant on the day of the procedure. Clearly fertile. I get pregnant on the day of the procedure. And she was like, okay, let's pivot. We're going to give you progesterone to keep your cervix strong until we make it to 13 weeks. The maternal fetal medicine doctor would put in a cerclage, which is a suture. That doctor puts in a cerclage. And she's like, come back in 7 weeks. And I'm like, ma'am, I've had 5 losses. Like, 7 weeks is crazy.
They don't have your H&P, by the way?
Yes.
Oh, okay.
I'm in the same healthcare system.
I was just curious.
Everybody knows me at this point.
Okay.
Health. This is the same healthcare system.
I just want to make sure that they didn't know. Right.
They knew. And when I talk to these doctors, they're like, yeah, we read all your stuff. This is insane. Like, that's the conversation initially. So you know me. You really do know me. So I'm asking her, I was like, can I come sooner, in 2 weeks or 3 weeks? And she was like, no, I've never seen a cerclage fail. If it does, you'll have excruciating pain and a lot of bleeding. I'm like, okay, well, that kind of makes sense. And I'm tired of advocating for myself. I'm just tired at this point. Okay, whatever. Come back at 20 weeks. I feel great. Mid-ultrasound, the tech just walks out the room. And that's unlike her. We talk and joke throughout all my appointments. She just walks out. So I turned to my husband at the time, and I'm like, we lost this baby. Like, the baby's lost. And he was like, how you know? She didn't even say that. I was like, did you not see how she just walked out this room? There's something wrong. Either the baby is gone or I'm losing the baby or something. I don't know. That doctor comes in, and she was like, hey, the cerclage failed. And I said, you told me it would be fireworks. What are you talking about? It failed. She was like, well, it happens. I've never seen it happen before, but it does. I was like, so what's next? Can you redo the cerclage? Can you put me on bed rest? I'm 20 weeks. I know. I just need 2 more weeks to make it to hit the micro preemie stage. Y'all NICU is a level 4. It can hold it. It can, keep my baby. Like, she was like, no, you could go and deliver casually.
And it's the doctor, not the tech at this point. This is the actual. And now, are you going to the same OB the same time, or are you going to a different person?
I'm going to OB, but this is a maternal fetal medicine doctor. This is the lady who put in the cerclage.
Right.
And she's like, it failed. She was like, go and deliver. And I was like, no, I don't want to do that. The baby is healthy. Like, what can we do? She was like, well, there's no standard of care to do anything else. I could call the 15th floor and tell them you're coming. Like, very dismissive, like, go ahead.
Was the doctor, I'm just going to say it, was the doctor African American?
Yeah. And, it's very hurtful because I do a lot of research, a lot. And the research shows that African American patients who are treated by African American providers have better healthcare outcomes.
Oh, 100%. Yeah, 100%.
So I made sure my team was African American.
Yeah. They're not perfect, though.
They're not
right?
perfect.
Yeah.
Didn't expect that.
Yeah.
That's what I was trying to avoid. So to have a sister do that to me was, and I hate telling this part of the story. I hate it.
This is a part of the story, though.
But I hate it.
Yeah. And
I hate what I'm about to tell you next. So I was like, no, I'm leaving. So I called my village. I called co-workers, everybody. I'm like, y'all, I'm 20 weeks pregnant. The cerclage failed. We have to save this baby. Baby is healthy. Something has to happen. I'm doing research and I found that a transabdominal cerclage, which is higher than the one that I had, is used in an instance and typically is successful even while pregnant when a transvaginal cerclage fails. So we got to find a doctor who can do it at 20 weeks. Here comes maternal health deserts, right? People think it's an absence of a building. No, it's an absence of providers or providers who can do a service that you need.
Well, this is a very specialty service, though, right?
It is.
A lot of people don't need it.
It is.
Yeah.
It is. So we found somebody in Texas, Dr. Fogwell at Texas Health. He calls me after I reach out to his team. He calls me that night. He said, I need you to fly to Texas. Dr. Fogwell, he does this. Like, he come in 007 like this. He ain't new to this. He chooses this.
Yeah.
He like, yeah, you need to fly here. If you want to fight, I'm going to fight with you. He told me the risk. We know it. He was like, but I'm going to tell you now, if this doesn't work, I'm going to fly you out on my own accord. And we're going to do the surgery outside of pregnancy if it doesn't work. Which is crazy for a doctor to say. I never expect that from a provider.
You never expect a provider to care?
Not to that level.
After what you've been through, no.
To fly a patient out, that's wild.
It's a bit much.
That's a whole new meaning to flued out. That's a whole new meaning.
Sorry for laughing, but damn, like that's not. No,
I didn't think being flued out that was gonna be what it felt like. I don't know, but
And what baby number is this, by the way?
This is 6.
Okay,
this is 6. So I booked a ticket. I get on American Airlines. I stop the stewardess and I say, "Listen, there's a baby falling out my vagina. We need to get to Dallas, Texas." Like, she's like, oh my God, like, you sure you should be right? I was like, I have no choice. I'm just letting you know in case something happens. But we need to make it to Dallas. 45 minutes or an hour and a half, whatever. We need to make it. I'm just letting you know what's going on. So if you hear me scream, that's why.
That's why.
She was like, okay, cool. She gave me a pen, like the little flight pen. She was like, make sure you have your seat. Shout out to American Airlines. No, I called them. They gave me a grant.
Really?
I told them the story.
I love that.
I told the story. So I made it to Dallas. They rolled out the red carpet from security to everybody. They knew me. Like, they knew me. They knew I was there. Wheelchair from the airport to the Uber to the hospital. They made sure I was good. He gave me a medicine to try and prevent contractions. He said the surgery would take 3 hours. That 3-hour surgery took 8 hours. Because I was on a flight, the baby came down even more. So he had to call a counterpart in to push the baby back in. So I wake up from anesthesia, like they're literally around my bed cheering, like we did it, like we good. So I'm like, oh my God, like I'm still pregnant. But when anesthesia wore off, the contractions set in. And I was in labor for 30 hours. And that man was at my bedside, 1 a.m., 1 p.m., 8 p.m. He texted me. I'm like, hey, doc, we need to try this tocolytic, which is a medicine to stop contraction. He was like, all right, order in. Or tell the nurse to give it. I'll put the order in. Like, listen, like, believe me. Like, I'm a part of the care team of my care. At 30 hours, my water broke. It was over. We had to go back to the OR, take out both of those cerclages. I gave birth on July 18, 21. And they cremated a baby, and there's a place at the hospital where he resides. But true to his word, he flew me back out there. I got flew out November. And he did the surgery, checked my uterus, made sure everything was clean from every pregnancy I lost. And I got pregnant that March, followed by the reproductive endocrinologist. Graduated to a different maternal fetal medicine doctor this time. I made it through, and I gave birth 12/30/2022. And he's now a pot-belly 2-year-old, about to be 3 years old. That belly, pot belly.
How in the hell are you able to, like, laugh through this, run through this? Like, this to me, I hear a lot of stories. I'm going to be honest with you. This is the one where I'm like,
yeah,
this is a lot.
It's a lot.
How are you able to keep going? Or is it therapy? How are you
It's
doing?
therapy. I started therapy after the Texas loss, and I still go every Thursday. I'm busy Thursday at 11. Consistent. I even tried hypnotherapy during pregnancy, and that helped.
I never tried that before.
Awesome.
Really? Like it works?
I had gave up after he flew me to Texas.
Yeah.
And that was like the last ditch effort. So I was like, I got to do it, but I just can't move forward. Hypnotherapy helped me move forward. It helped me move forward. But definitely therapy has been huge in my journey. And also from being from New Orleans, like going back to my culture, hurricanes like take everything from us like this. Like you can't hold on to none, even your people. And it's just like, I really think it's embedded in me to have that hyper resilience. Like, man, like we know at any moment, like stuff could just be gone, like just like that. So I carry that with me and that resilience with me. And it has served me throughout my pregnancy journey and my neurological journey.
It's so interesting too, because had you not had that specialty, that we probably wouldn't be sitting here.
No.
Like you can confidently say that.
Oh, 100%.
Yeah.
I had to speak that language.
I wonder long term. You said so you were married at that time as well. Mm-hmm. Do you want more kids? Is it possible for you to have more kids?
I want more kids. It has to be through surrogacy. Mm-hmm. Because with the neurological issue, I can't gain weight. Like I cannot gain weight. Or I'm gonna pass. But I really want more kids. But if I didn't have kids, I'd be fine with my one. We'd be rolling out, you know. I hop on a plane, go to Mexico, you know.
Really?
Yeah, at 6 months, like right before my symptoms started, I was in Mexico with my child.
Really?
For my passport, I was like, we gotta go. Mama travel. Like, we ain't stopping nothing. Like, I'm starting businesses. I'm completing businesses. Yeah. I'm doing my schoolwork.
I love that.
You audition. You ain't no burden.
I love that.
Yeah,
I really love that.
In a heartbeat. Even when I was sick with my neurological issues, like, this organization flew us out to Washington to advocate for maternal mental health care and how it impacts 0 to 3 aged kids. And he was right there. Like,
is there any correlation between the miscarriages and your brain?
I had one neurologist that said your body is so used to being pregnant and, you know, we retain a lot of fluid during pregnancy that it doesn't know where to go. So it's going to your head. I had that happen, and but nobody else has, but maybe so, you know.
How do you feel now?
I feel great. Yeah. Like, when I tell you, there's nothing like waking up and you can see for sure. Like, you start appreciating the little things. Like, I could see when I wake up for sure. I know when I go to sleep tonight, Lord spare, I wake up tomorrow, I'm going to be able to see my child. And that feels so great. I'm not waking up with a headache. I'm not debilitated. I could be a mom, a business owner. I just started a health tech company 3 weeks after I had my surgery.
What y'all doing?
We create an app called SpeakRx.
Okay.
And I'm helping other patients advocate for themselves in a healthcare setting. And on a lower level, we use AI, but it's human backed, so it ain't gonna be like ChatGPT telling you to remove salt and you die. Yeah. But we're telling you step by step, move to this hospital, or that provider has a horrible rating, like they're used to doing stuff like this. We should escalate this harm. Based off everything you put in, we already created an email to send it here. This how you fill out joint commission, like all that. On the second tier, they can talk in real time to a healthcare provider, and we're like, do this. You're going to survive this. And then on the third tier, you can speak to a lawyer or a legal nurse consultant.
I think I'm liking this. It kind of reminds me, I find some things there. We're, like I told you, we have a little, well, I can say it. We're working on our EMR system. Yeah. And this, I see some things there. They can kind of work together. Yeah. It's almost like a perfect plug and play. Yeah. Ours is a little bit more AI based.
Okay. Well, the initial tier is AI based, but just human backs. And that's important right now because AI is biased. There's a lot of misinformation. And it can only give you advice based off what you tell it, right? So we're healthcare providers. We know we need more background and all those things. But I'm giving people everything that I had to survive. Mm-hmm. I was calling up friends, like neurosurgeons and neurologists that I knew, telling them what was going on. They were helping me advocate, you know. I posted on LinkedIn and random neurologists and neurosurgeons called me to help me through that time, the peer review articles, the reason why I'm here, now. So I'm giving people all of those things, the jargon that they don't have, the expertise that they don't have to navigate whatever diagnosis that they may or may not have yet. So I wanted to give people that to help them survive. Yeah.
I love this. I actually really love this more than you know. Because one of the things is I like Google reviews, right? I get all that stuff, right? But one of the things is actually having real people who've been to these people who can say, this is how this person treated me.
Yeah.
Doesn't mean that they're not great at what they do. But this what's more important, and we talk about in hospice, is bedside manner. This is how this person treated me. This is how this person took serious my issue, my diagnosis, and having a place to go to. And it doesn't have to be all bad.
Yeah.
That's the other part about it, right? Like it can be some good things too.
We need a green book. We need that.
I like this a lot. Yeah. I like this a lot. And I'm going to tell you, as someone who has a 3-year-old son, I really like it for kids.
Yeah.
One of the things with my son, and I haven't really talked about this a lot, but slightly speech delayed, right?
Same.
Okay.
Same with my son.
The doctor, pediatrician, who I asked to change a bunch of times, just never really, I never felt like he picked up on the cues. And the reason how I first found out was because I have a speech therapist that works for the hospice. Right. And that's how I first found out, like, okay, we have a slight concern. She said, take it back to the pediatrician. The pediatrician's like, oh, it's fine. It's like, but to your point, is this pediatrician really working in the best interest of this particular child? Right. And did I have to tell him, let me tell you what changed it. Okay, this is what I do for a living, right? Either we're going to have a real conversation here or I'm going to tell you how I would handle this in my profession. Right. And his whole demeanor changed. Right. But why do we have to go there?
Why do you have to
Why do I have to go there?
Why can't you just be the patient?
Just be
or the caregiver for your son.
Yeah, exactly. That's super interesting. When is the app going to be deployed?
Late January for the beta. Yep.
I think I want a part of that.
Yeah, come have fun and team. I have an advisory team meeting later on today.
Yeah, I think I want to figure out how we can be a part of that.
Yeah, if you have time, please join my meeting. It's at 6:00, and you can really see that what we're doing in the app and everything. And we have an amazing advisory, research, and legal team.
Yeah,
we're stacked.
Okay,
with expertise. So
okay, I think I like this. Yeah. I think I really like this.
Yeah, and it's also walking my purpose. Like I started all of this, planting a seed in between the 2 brain surgeries. 3 weeks after my second brain surgery, I started it. I filed for the LLC and everything. I got a $50,000 grant the same month I started it.
Is it a nonprofit?
No, my nonprofit is different. That's for maternal health. So this is the LLC for my my app. Yeah. So it's in development. Yeah, I'm excited. Like it's gonna save lives.
Yeah, I want to be a part of that to some degree.
Yeah, come and just see what's up if you have time today.
We'll make time. Make time. The other part of that, you say you're walking in your purpose. People don't. I don't know if do you read. I read a lot. Well, obviously, you read a lot. You can get a doctor. I am reading this. I just read. Well, I read this book called A Purpose-Driven Life.
Oh my God!
So you read that book?
It is so scary you say that. My grandfather gifted me that book when I was a child and couldn't even understand that book. And I'm trying not to cry because that book is like such a big part of my childhood. Because I used to read it and I couldn't understand it when I was younger, but I kept it with me, and every now and then I'll just read it. And he said, "This book is going to change your life." How did you even know that? My grandparents always saw something in me. Like they called me doctor when I was young. Like now I'm making a profit. You know, they were always the most supportive people, like in my corner. Anything I did, I wanted to do, my grandparents already believed it was done. And that was that book that he had gifted me to keep me afloat doing certain things. He had the same upbringing, my grandfather, with his parents. And so he saw me, if you know what I mean. Like,
I got you. Yeah. So that book changed my life. I just read it this year. I read a book a week, right? And that one is one that I read back to back. Yeah. Because I had to play it back. I had to go back through and really understand like what it is. What was your best chapter in that book? I'm an advocate for this book. For those who don't know, literally give
Not you
this
going on a
book.
book tour.
No,
like, we need to bring this back out.
Not even my book, right? I just give the book away. I'm like, I buy them off Amazon 5-10 at a time, and I just hand them out. I'm like, bro, you need this. Like, you're struggling.
I can't, because there's so many points and traumas that have happened throughout my life. Like, after the brain surgery, I'm finally able to like breathe. Mm-hmm. Like, this is the first period in my life where I don't have to worry about hurricanes, health issues, just nothing. Like, I'm really in a recovery period. And that book, like, I could attribute it to different times in my life. So I just can't. The book is amazing. Like, y'all read that book.
Yeah, no, for real. It's a real thing. And that's your granddad's in nursing home?
Yeah.
When you going back to see him?
I would love to go back and see him this weekend. I drive. I have a Jeep. I have in my Wrangler real quick, and I just
How long is that? 9 hours?
Oh no, 6.
From here to New Orleans?
6.5.
Okay, well, that's
7
not bad.
for you.
That's not bad. I'm not a driver. I drive really slow for one.
Oh, okay.
Like extreme.
8 for you.
Like grandpa slow.
9.
Yeah, I have nowhere to go. Like, I'm just chilling.
Nah, I love driving though. It clear my mind. I can listen to my audiobooks and yeah.
You take your child with you?
Yep. Not all the time, but yeah, he hops in a Jeep too, and he likes to look out the window. He's chill, but yeah, I'll try to go this weekend. Yeah, before Thanksgiving.
You also told me that you were back in school. You're still in school?
Yeah, I started my doctorate 3 weeks after my second brain surgery in nursing informatics. So yeah, I'm back in school.
How's that going?
Much easier than the bachelor's in nursing. That's like the hardest degree. It's like in the Guinness World Record for the hardest degree.
I believe it. Yeah.
Yeah. So doctorate easy. To be honest.
What about that brain surgery has changed you?
Oh, in so many ways. Like, my appreciation for life, I already had an appreciation just because of what I've been through, but it taught me to also slow down too. I'm very type A workaholic. On to the next. Don't celebrate accomplishments because I don't stay down too long. Like, it's on to the next. That surgery made me sit down. Mm-hmm. Like, for real, sit down and like enjoy the fruits of my labor and the small things and the big things. Mm-hmm. And God knows, like, I'm stubborn. Like,
are you really?
Yeah. When it comes to like work, I'm gonna work. Like, I'm gonna do what I do. I'm going after all my goals unapologetically. There's nothing. My grandfather and my grandmother instilled this to me. There is nothing that comes to mind that I cannot execute.
Were you like this pre-brain? Yes. Okay, so you've always been like you were straight A student, though. Yeah.
Childhood, like.
I almost flunked out of college, so yeah.
Really?
Yeah.
I flunked out of nursing school.
Really?
Because I was working so much because I couldn't afford it. But people don't know that. I flunked out the first time. So if you ever want to get your higher education degree, don't worry about it if you're struggling right now in your lower level degree. Like, you still could do it. But yeah, like, I'm a type A. I'm gonna get it done, and I'm gonna make I don't have dreams. I only have goals. Like.
So I have to ask this question only because for me, I've recently been like pushed into this political thing of trying to understand it, right? What are your thoughts on pro-life?
So I am pro-choice because of quite a few things. One, because of my own situation. If I got pregnant right now, I could not have that baby, or it would be me or the baby, and we probably wouldn't survive. We'd probably both die. Miscarriage care is sometimes synonymous with abortion care, but also I'm pro-choice because I feel like women should have a choice, like in their bodies, for many reasons. I'm just thinking back on the times where I just couldn't have a baby and give that baby a good life. Mm-hmm. And I never wanted to bring a child into this world and not be able to fully take care of that baby.
Right. So that for me, it's right. So, and it's like obviously a question that everyone is constantly bringing up, but it's right. For me to have an opinion is ridiculous as a man, right? It's really not, it has nothing to do with us, right? I don't even understand why we have an opinion about what women should do, right? That's my personal opinion. My thing is, as a woman, for someone who can say, if I were to get pregnant, one of us would pass away. This is why. Like, I think that needs to be talked about a little bit more. And I think specifically in America, we kind of take religion and kind of dictate when religion is important to us and when it's not as important to us, right? It's okay for you not to do this, but it's also not, it's okay for, and it's like, that doesn't really sit well with, and that's why you have so many people our age like, well, I'm not going to church because like, this is what y'all do. Right. This is how y'all act. So I just had to ask that, and hopefully, like, I just wanted to know what your thoughts were on that.
But to your point, like, at what point do we really believe in separation of church and state? Like, what does that come in at? Why, when we talk about abortion, then we start talking about God again?
Yeah. I think a lot of the abortion talk, particularly in the South with the Republicans, is due to their beliefs or whoever's beliefs in Christianity. Right. And I think they say, well, you should not. They use the phrase like murder a baby or unborn baby, even if the mother has to pass away. Like, there was a huge story about the young lady from, I think she was actually at Emory.
Oh, yeah. Adriana Smith.
Correct.
Yeah.
And that was
huge because of the heartbeat bill, which is insane. It is insane. I'm going to do Maternal Health Day in January at the Capitol and advocate against that because my baby will be there too. I like to take him to things like that. Okay. Hopefully. Yeah, I'm seeing the information, but the heartbeat bill, you cannot have an abortion after you get a heartbeat. Heartbeat, you can detect it usually around 5, 6, 7 weeks. Women don't typically know they're pregnant, unless you like me. I knew I was pregnant, or IVF moms who test and, it's on a certain regimen. Most people do not know they're pregnant during that time.
Right.
So you're robbing them of that treatment, that plan of care, that treatment. That story is so heartbreaking because her mom still had to pay for those medical bills after they used her as a human incubator for months. And it's just a heartbreaking story. She shouldn't even have to pay those bills.
I think she was a nurse too.
She was a nurse.
And
I saw myself in Adriana Smith because she had a headache and she went to the ER and she told them people she had a headache. And just like me, she was turned around. And just like me, you're just tired, right? We talking about I'm having these symptoms after 9 pregnancy loss. I'm tired. I don't feel like fussing with you and trying to prove I have a headache. I'm not trying to do that. But she went home. I didn't. I went to another ER. She was not so lucky, right? They found her dead and then brain dead.
Is the baby still alive? Do you know?
Yeah, he's still alive. I know he had hydrocephalus at one point I saw, but I'm not sure how he's doing today. And I hope he's doing well. And I hope her mom is finding solace during this time.
Yeah, it's tough.
What a horrible way for your child to pass. And then publicly.
I also think about, I'm a person who I think in the healthcare system, we forget about 2 people, social workers and nurses. I think we put a lot of emphasis on doctors. And I mean, I get it, kind of the hierarchy of the positions within the healthcare system. A nurse has to go back into that room every day.
Every day. A
social worker who's essentially going back in that room every day and then having to go home and still function as a normal person is like extreme for me, right? And I'm in hospice, so I can say this. Yeah. For me, it's like, I don't know if people who are writing laws truly understand everyone that's being affected by the laws that they're writing. So if nothing else, for those who write laws, it seems to me to make the most sense to bring us into the rooms, right? If you need to understand what happens in these cases, you have to bring people into the rooms. But then there's a whole other thing of, you got people writing laws who probably shouldn't be in office anymore, right? Like, let it go, dog. Like,
but that's so true. That's why I show up, like not just as a nurse or just a civilian or whatever, but also as a person with lived experience. So when I went on Capitol Hill to tell my story, like, people may forget my name, my face, but they never forget that story. Like, you'll never forget that story that I just told you. So it's a catalyst for change. That's why lived experience is so important right now. And that can truly make a difference in the laws. Some people or lawmakers, I can say, don't care, but some of them just don't know.
They don't know.
Like, they don't know what's going on outside these Capitol walls and things like that. So it's so important to advocate with them and tell your story and get other people's story and bring it to them. It is very, very important.
Okay. Well, I appreciate you. It's been a pleasure. Is there any last words that you're like, okay, look, this is what I need y'all to know. Anything that we can do to help you outside of the app? Because I'm excited about that. I'm telling you, because I am a low-key a tech junkie, right?
Oh, yeah.
Yeah, like
not with no Google Chrome, but I saw you got a Mac.
No. I mean, don't do that. So
he have a Mac, y'all. He got a Mac.
I feel like that most of the stuff that I use the Mac for, someone else does that for us, right? I don't need to edit, right? I'm not really doing.
I understand
anything.
You have privilege.
Yeah,
I understand you got the staff. Absolutely.
So no, but really, like, what can we do to help you? Like, how can we get you? I mean, obviously this part, but what is it that me or anybody can do to kind of be a part of your journey?
Yeah. Well, you already do this, but one of the big things is believe Black women. There's that video circulating around, and that is a great display of why Black women are 3 to 4 times more likely to die of pregnancy-related complications than our counterparts. It's circulating around the internet if you ever wonder why and what that really looks like. We need to be not just listened to, but believed. But also, I do have a nonprofit, A Light After 9. Please follow us. You could go to alightafter9.org or follow us at A Light After 9 on social media. And if you're interested in the app, being a beta user or want to get involved, then SpeakRx is the app. You can follow us at SpeakRx app. We're gonna do a lot of amazing things.
Oh yeah, you are. Cause we're gonna help you. I'm gonna. I'm telling you, like I really am. Like that's how my brain works. So I'm like, okay, let me see how I can get on part of this.
Yeah, he ain't gonna be our co-founder.
No, I don't know about all that shit. I don't know about all that. But I mean, you never know. Like I was telling you, that's what we're looking to do. But I appreciate you. Thank you.
For having me.
And I'm excited. And I love the blue suit. I was just telling you.
Thank you.
Women need to wear suits more. And the one time I don't wear a suit, you wear a suit. You showed me up.
I
clearly,
knew
right?
Henry was gonna come here with a suit. I was like, I gotta make sure I look fresh.
It was one of them days. But I appreciate you. And for y'all, make sure y'all check her out. And thank y'all for watching.